Hey everyone, and welcome to this explainer. Today we're doing a rapid, high-yield review of the invisible shield that keeps our clinical environments safe. We're talking about infection control. Let's dive right into the mechanics of sterilization, pasteurization, and biomedical waste management.
Here is our roadmap for today. First, we'll cover the principles of infection control. Second, pasteurization. Third, disinfection methods. Fourth, managing biomedical waste. And we'll finish up with a high-yield rapid review.
All right, let's get into Section 1, Principles of Infection Control, the baseline.
So what's the actual difference between sterilization and disinfection? Well, it really comes down to the scope of destruction. Sterilization is absolute. It completely wipes out all microorganisms. And yes, that includes those highly resistant bacterial spores. Disinfection, on the other hand, is more of a targeted strike. It destroys or inhibits pathogenic vegetative organisms on inanimate objects, neutralizing the immediate threat, even if it doesn't wipe out every single spore.
Now, these aren't just academic definitions, right? The stakes here are incredibly high. These exact protocols are what protect our most vulnerable environments, from operation theaters to blood banks. They are absolutely crucial for preventing the transmission of severe pathogens like Mycobacterium bovis, Salmonella, and Brucella. Infection control is literally what ensures these facilities don't become ground zero for an outbreak.
Moving right along to Section 2, Pasteurization, protecting our liquids. Think about it for a second. How do we actually make liquids safe from pathogens without completely destroying their taste or their nutritional value? That delicate balancing act is exactly what sparked Louis Pasteur's historical breakthrough using moderate, controlled heat.
It's all about that precise dance between temperature and time. Take a look at the Holder method. It uses a load temperature of 63 degrees Celsius for 30 minutes. But then we have the Flash method, or HTST. This bumps the heat up to 72 degrees for just 15 seconds, making it a highly efficient commercial standard because it preserves that fresh taste. And finally, the ultra-high temperature, or UHT method. This one blasts the liquid at 135 to 150 degrees, but only for 1 to 2 seconds. That's what allows for long-term storage without any refrigeration.
But how do we actually know the process worked? In a clinical or industrial setting, we verify it using the Phosphatase test. Now, the enzyme alkaline phosphatase is naturally present in milk. And, conveniently enough, it gets destroyed at the exact same temperature required to kill pathogenic bacteria. So, if this enzyme survives, giving us a positive test result, it acts like a massive alarm bell for inadequate heating. If the enzyme is destroyed, we know for sure the pasteurization was adequate. Okay, let's jump to Section 3, Disinfection Methods and Levels. Think of disinfectants as having a stepped hierarchy. High-level disinfectants, like 2% glutaraldehyde or hydrogen peroxide, are your heavy hitters. They take out vegetative bacteria, mycobacteria, and most spores. We absolutely rely on these for critical, semi-critical items like endoscopes. Then we step down to intermediate-level disinfectants, your alcohols and phenolics. These handle mycobacteria and most viruses, which makes them perfect for skin-level prep. Finally, we have low-level disinfectants, like quaternary ammonium compounds. These are for routine environmental cleaning. They target some bacteria and viruses, but leave the tough spores completely intact. Let's talk about physical methods for a second, specifically ultraviolet radiation. It's a brilliantly clever tool that directly damages microbial DNA by forming thymine dimers. Basically, it physically kinks the genetic code so the microbe can't replicate. It's a fantastic way to sterilize the air in an operation theater or a biosafety cabinet, but keep in mind its one huge limitation. UV light has very poor penetrating power. Even a layer of common dust can block it. Now let's put two of the most common chemical heavy hitters head-to-head. Chlorine compounds, like bleaching powder, work through oxidation. They release hypochlorous acid, making them the absolute go-to for large-scale water purification and safely managing hazardous blood spills. Phenol, on the other hand, operates entirely differently. It physically damages cell membranes and precipitates proteins. Because of this distinct mechanism, phenolic derivatives, like Lysol, are the gold standard for heavy-duty floor and surface cleaning. Which brings us to Section 4, Managing Biomedical Waste. Segregating waste exactly at the point of generation is absolutely paramount. It's like a high-stakes matching game. First up, the yellow bag. This is strictly for highly infectious organic materials. We're talking human anatomical waste, animal waste, soil dressings, and placenta. Because the biological risk here is so extreme, the only acceptable treatments are total incineration to ash or deep burial.
Next, we have the red bag.
This container is specifically for contaminated recyclable items. Think medical plastics, IV tubes, catheters, syringes without the needles, of course, and gloves. Now, you cannot safely incinerate chlorinated plastics because they release toxic emissions, so the required treatment here is sterilizing them first with pressurized steam, autoclaving, and then physically shredding them before they can be recycled.
Now pay close attention to the white translucent container. It has to be structurally puncture-proof because it is exclusively for sharps, needles, scalpels, and blades. Improper sharps management is actually the leading cause of occupational HIV and hepatitis B transmission among healthcare workers. Because of that severe risk, these items require rigorous treatment using autoclaving or dry heat sterilization to ensure complete safety.
And we finish the sequence with the blue container. This guy has a very rigid, specific role, capturing glassware, broken vials, and metallic implants. Once safely collected to prevent any laceration injuries, these items undergo targeted disinfection before they're finally sent off for recycling.
Let's wrap things up with Section 5, a high-yield, rapid review.
First metric to remember, 70%. When using alcohol for intermediate-level disinfection, 70% is the absolute most effective concentration. You might assume 100% is better, right? Actually, no. Water is biologically required in the mix because it facilitates the protein denaturation and cellular penetration needed to truly destroy the pathogen. Next number to burn into your brain is 63. Remember, 63 degrees Celsius for exactly 30 minutes. That is your baseline foundational metric for the Holder method of pasteurization.
And let's do a super quick recap of the waste segregation matrix. Yellow is for anatomical waste, red is for contaminated plastics, white is for those dangerous sharps, and blue is for glassware. Getting this segregation right exactly at the source is the single most important action in keeping any clinical environment safe.
So, the next time you're walking through a hospital ward, or honestly, even just pouring your morning glass of milk, ask yourself if you recognize the invisible science protecting you. Infection control isn't just some boring set of hospital rules. It's the unseen, life-saving framework that makes all of modern medicine possible. Thank you so much for joining me on this explainer, and keep looking for the science hidden right in plain sight.